Ascellon Corporation has, as a company, has been in the fraud, waste, and abuse battle at the federal level, working with the Centers for Medicare and Medicaid Services, CMS, since 1997. And so in the last 15 years, what we have done as a company is to work very closely at the federal level with our customer, CMS, to come up with innovative solutions, some great ideas on fighting fraud, waste, and abuse in the federal healthcare Medicare program. And that has been really a very challenging and rewarding work because, as you all know, there's a lot of money in the Medicare program. That is one of the largest federal programs that we have outside of the DoD. And in that regard, there's a lot of money, and there are very sophisticated schemes that some of the best criminal minds have devised to cheat the system, to rob the government, and essentially make this program a lot more expensive than it should be in a lot of cases. What we have done is to help the government to use technology, to use some of the more sophisticated program auditing techniques to fight fraud, waste, and abuse.
I think that there's been a real recognition of the fraud and abuse and the waste in spending, and a real concern about how do state governments and federal governments get at that and reduce it. If you were to go back a few years ago, fee-for-service fraud and abuse reduction, there was quite a bit of experience in that market. The demand of the marketplace in healthcare is largely moving to managed care, even in Medicaid managed care. The qualifications of groups such as Ascellon, who've had the experience on the fee-for-service and the managed care and the Medicare market, is really the market that we're moving into in the states on the Medicaid side. So in short, I'd say that now there's an opportunity, there's the capacity and technology, there's increasing sophistication on the business side, and there's a tremendous demand to get at this and root out fraud and abuse.
There's so many ways that the public loses out when money is siphoned from programs, where the program is really not serving the beneficiaries or the people who are supposed to benefit from those programs. Take, for instance, in the fraud and abuse world, I know we talk about fraud and abuse generally, but they are very specialized and compartmentalized areas of fraud that are very unique to each situation. For instance, there's enrollment fraud, where you have people who are using the wrong identification, or people who enroll people who are not supposed to be receiving benefits. That's one part of it. So that's a huge part of that type of fraud, waste, and abuse issue. There are issues of services that are never rendered. So that's another part of it. And of course, there are services where the government overpays for services that are actually rendered. That's another situation. But the more insidious type of fraud, where the wave is now, they are legal providers. They are actually people who are enrolled in the service. But then you get into the nuances of, is this the right payment? Is this the right service? And there's a lot of money there. And that's where the taxpayer, I think, is really taking a hit, because those are a lot more difficult to identify. We are moving from a predominantly fee-for-service healthcare system to a managed care healthcare system. In the past, the incentive for fraud in a fee-for-service is well known. Everybody knows. You bill for services you didn't render. You use the wrong clinical codes that pay more and things like that. But in the managed care world, you're being paid a capitated rate, what we call a capitation fee, which is a fixed amount for each person that you cover. In that regard, the incentive is different. The incentive is to underservice the people who are enrolled, or rather to engage in fraudulent marketing services, or to only enroll people who are very healthy and drop people who are very sick. So the approach needs to be that as we move towards this managed care world, that the people who are in charge of fighting fraud and the people who are in charge of maintaining program integrity pay attention to the differences between managed care and fee-for-service.
A number of our agencies, when I was secretary, were extremely effective at getting to the fraud and abuse issue, largely because we couldn't have financed the services we were trying to do without that. Having said that, when I look at the situation today, as was mentioned earlier, you've got billions of dollars in fraud and abuse, and even where you have very successful strategies to reduce it, you may be reducing or tackling only 20 or 25% of the amount that you have reason to believe exists, because in the past, either the technologies and models to attack it delivered only that return. The real potential with a company like Ascellon, and the real need in the marketplace, is to get at that delta between that 25% and 100%. Because when you get to that, you're talking billions of dollars nationally. And technology and the models and thinking of companies such as this are putting us in a situation where we can take ideas and strategies in the commercial market, the Medicare market, the state market, leverage those and start to get at those real cost savings.
We have the analytic tools that the private sector can use and can be used by the private sector to identify the same things that the federal government would have identified or the state government would have identified in terms of looking for fraud and abuse in the healthcare program. So that's one thing. The other thing that's also the other factor that's played into this over the last few years is, as I mentioned in my previous segment, that Medicare, from the federal standpoint, has really some of the best solutions for identifying fraud, waste, and abuse in healthcare. And what the federal government has done is said, look, to the states, we will cover some of your expenses if you use some of the tools and if you take some of the approaches that we have taken at the federal level. So we're seeing the states now rolling out programs that are similar to what the Medicare program has had for the last few years, such as the RAC program, such as identifying system-wide payment errors and overpayments and making those calculations. And by using statistical methods, analytic methods, and investigative techniques, they can actually begin to quantify how much error, how much overpayment they have in the Medicaid program. And of course, once you identify, then you can create tools and approaches to recover.
From the technology point of view, if you were an investigator on the federal or state government or any other employee who was working on fraud and abuse, in the past, you really would, you would have a lot of data and limited ability to know what to do with that data. And oftentimes, if you embarked on a new project, you'd have to bring in programmers or technologists to help you rewrite the systems that you had in place. The opportunity now on the technology side is that you can now engage the worker. The worker has control, as was emphasized. The worker can look at the data. The worker has access to dashboards, to visuals, to track particular, the success or the strategies they're embarking on. And they are empowered, actually, to follow the direction and expand on successes that they've had or identify areas where they think there may be fraud and abuse that in the past would have been too cumbersome a process for them. So the technology is actually moved from the back room where you had programmers to very flexible strategies and capacities for the workers to actually design the approach.
With the Microsoft description that we just heard of where of the focus to put technology in everybody's hands, we are perfectly positioned to take advantage of that because the technology is there. And Ascellon has, through our expertise in the programs, in the program areas, as well as technical and experience with technology, we have created this tool, Answers, and Answers does just that. It takes a very powerful tool and very user-friendly and very intuitive and puts it in the hands of people who are responsible for maintaining integrity in publicly funded programs. And by doing that, they can get really creative and they can find things that they couldn't find before. And more importantly, this approach actually reduces the cost of fighting fraud, waste, and abuse. As you are going after these cases, if you have cumbersome tools, if it requires a lot of activity and a lot of expertise just to go after what you're trying to recover, it becomes expensive. It becomes, in itself, discourages the program integrity people from going after things unless they're very sure that the payoff is there. But when you have a tool that cuts that cost down, then you have more of an opportunity to go after more. And that's where you cover that delta that we mentioned earlier between recovering just 20% to maybe recovering 90%, because it's easier to do, it's more cost effective to do, and you have more opportunities to go after things that you hadn't gone after in the past.